Hello guys, I am Kim Jonghyun. Today, I'm here to introduce sex education. Especially my topic is how to contracept. We all recognize contraception is important and mandatory thing for us who do not want to pregnant babies. But we only know few ways to avoid pregnancy, such as condoms. However, there are lots of methods to prevent pregnancy. Today, I will introduce 5 types of contraception. First, barrier methods. It is easy to say condoms. Barrier methods include cervical cap, male condom, female condom, spermicide foam, and sponges. This way blocks sperm from entering the womb. There are some benefits of this method. They are only used at the time of sexual intercourse. They do not affect other health conditions such as high blood pressure or diabetes. Also, condoms are the only birth control method that protect against STIs, including infection with the HIV. The second one is hormonal contraceptives. It includes the pill and the Depo-Provera injection. There are 2 kinds of pill. First one is combined oral contraceptive pill, and the other one is progestogen only contraceptive. The Depo-Provera injection is also a kind of hormonal contraception. You get an injection every 3 months. If you get your injections on time, Depo-Provera is more than 99% effective. Emergency contraception is other way to prevent pregnancy. Emergency contraceptive pill, called ECP, and a copper IUD are included in this way. Women can use the ECP and copper IUD when they had unprotected sex. But you do not use the ECP as a regular way to contracept because the ECP causes many side effects such as vomiting, headache, and breast pain. The fourth is long-acting reversible contraception. It includes injections and devices. Depending on each device, some are put in your underarms and the others are inserted into your uranus. They can be removable and work for 5 or 10 years. Nowadays, this type of contraception is popular among young ladies. The last way to prevent pregnancy is permanent contraception. It's sometimes called sterilization, prevents all future pregnancies. So it is very difficult or impossible to reverse. So this is the end of our topic today. Did you enjoy this? Thank you and hope to see you in the next video again. Bye!
Hello everyone, so in this video I'll talk about personal hygiene. So one may ask, what is hygiene? So hygiene is basically a way to keep the body clean and protect us from diseases, and then also it helps us to boost our confidence level when you're among your friends, when you're among your peers, like you don't feel shy because you don't have a smelly body and all that. So one way or the other, practicing personal hygiene boosts our confidence level. That is why we should practice personal hygiene. So in this video, I'll share with you some of the things that you can do to help keep your body clean and to keep the body hygiene as well. So first of all, we need to bath twice daily. Even if you can bath twice daily, at least once a day is okay. Brush your teeth twice a day. Use deodorant to keep you fresh, and yeah, because it's also good. And always remember to clean your environment, like sweep, mopping, and all that. And then also we need to wear clean socks, clean undies all the time. We shouldn't repeat undies and bra all the time. Like at least as a lady, you should have multiples of undies or a lot of undies or bra to put on, so that at least you can wear them within the week. And at the end of the week, so let's say from Monday to Friday, you wear this undies. So at the end of the week, which is Friday, you just wash them nicely and then you iron them afterwards, and then you wear them because it really helps. And I think if we do this, it will really help us and protect us from any diseases. And also we should also try and then wash our hands all the time, especially when you go to town and then you come back to the room. You need to wash your hands whenever you go to town and you buy something and you don't have water or soap with you, if you do have hand sanitizer, do not forget to rub some on your palm before eating, because we need to protect ourselves from any germs or any viruses that's surrounded. I think this is some of the basic things we can practice at home to protect ourselves from any diseases and keep us healthy. Thank you so much.
Hello, my name is Javi, and today I'm going to talk about sexual orientation. There are many labels to describe who you are romantically and sexually attracted to. You may have already spent a lot of time thinking about your sexual orientation, or maybe you haven't thought about it at all. Anyway, sexual orientation is just a part of who you are. It's not known for certain what cases a person to be lesbian, gay, straight or bisexual, but your sexual orientation has probably begun to be defined at a young age. This does not mean that sexual feelings existed, just that you have feelings through a person that attracts you. As the feelings grow, they become stronger and shape your sexual identity. Sometimes sexual orientation changes over time, and sometimes it remains stable throughout life. But sexual orientation is not an option and cannot be changed with therapy, treatment, or pressure from family and friends. You also can't make someone else gay. For example, a girl who plays with toys traditionally associated with boys is not going to become a lesbian because of that. Sexual orientation can be incredibly simple. You are a woman who has always liked both men or women, and you define yourself as a bisexual. Or it can be much more complex. It can take many years for you to understand your sexual orientation and come out of the closet. Some people call themselves in question, which means that they are not sure about their sexual orientation or gender identity. This is very common, especially in twins.
I am Alejandro Ferrer, and my topic about sex education is abortion. What is it? Abortion is a voluntary or involuntary termination of pregnancy before the embryo or fetus is fit to life outside the womb. Now I'm going to talk about kinds of abortion. There are two different types of abortion. The first one is through medicament. You take pills that end the pregnancy and cause the uterus to flush out the pregnancy tissues, such as a miscarriage, early gestation. The efficiency of this one is, before 8 weeks, between 94 to 98%. Between 8 to 11 weeks, it's 87 to 93%. The other one is performed by an intervention in a clinic. A doctor, a nurse, or other health professional use medical instruments and Galtry sacks to remove the pregnancy from your uterus. This is more effective than the other one. It has a 99% effectivity. The main reasons to carry out the abortion are the following. They are not ready to be parents yet. It's not a good time in your life to have a baby. They want to finish their education, focus on work, or achieve other goals before having a baby. They are not in a relationship with someone they would like to have a baby with. Are in an abusive relationship or have been sexually assaulted, or they just don't want to be parents. Questions that help you make the decision. I am ready to be a mother. Would you consider giving up for adoption? How will having a child influence my future now? How will my career goals be affected if I decide to have a baby? There are someone pressuring me to abort or not to abort? Will the decision to have a baby change my life in a way that I want or don't want? What kind of support would I need if I decide to have an abortion? And the last one, is abortion safe? Millions of people facing pregnancies each year, and nearly 4 out of them choose to have an abortion. Sometimes even people who planned their pregnancies must also have an abortion for medical complications. Both of medical abortion and clinical abortion are very safe. In fact, abortion is one of the safest medical methods out there.